Today we are covering the essentials of musculoskeletal assessment for your NCLEX exam. The most critical part of any musculoskeletal assessment, especially after trauma, a fracture, or casting, is the neurovascular check. The exam will test your ability to prioritize this assessment above all else. Picture a question where a patient with a new long leg cast reports increasing pain that is not relieved by morphine. Your answer will always be to perform a neurovascular assessment immediately. You are looking for the 5 P's of compartment syndrome, a limb-threatening emergency. These are pain, pallor, pulselessness, paresthesia, and paralysis. The earliest sign is typically pain that is out of proportion to the injury. A common exam trap is to offer pain medication as the first option. While pain management is important, assessing for a serious complication like compartment syndrome takes priority. Don't fall for it. Assessment comes first. When evaluating range of motion, the NCLEX will want you to know the difference between active and passive. Active range of motion is when the patient moves their own joints. Passive is when you, the nurse, move the joints for them. An exam question might describe a post-stroke patient whom the nurse is assisting with exercises by moving their limbs. This is passive range of motion, and its goal is to prevent contractures, not to build muscle. Muscle strength grading is another key area. It's a 0 to 5 scale. 0 means no contraction, while 5 is full strength against gravity and resistance. The exam will link this grading to patient care. For instance, a patient with a grade of 2 out of 5 in their lower extremities can only move their legs when supported, not against gravity. This patient is not a candidate for a walker. They require a lift for safe transfer, making this a crucial safety determination. Gait analysis helps determine the correct use of mobility aids. The NCLEX loves to test your knowledge on how to use a cane. A simple way to remember this is the mnemonic COL, which stands for cane opposite affected leg. If a patient has a weak right leg, they should hold the cane in their left hand. This widens their base of support and shifts weight away from the weaker side. The exam might present a picture or describe a patient using a cane incorrectly and ask you to identify the need for further teaching. When it comes to safe patient handling, the principle of using your legs, not your back, and keeping the patient close to your body is frequently tested in safety-focused questions. You might see a question asking for the most appropriate action when repositioning a heavy patient, where the correct answer involves using a friction-reducing sheet and asking for help, rather than attempting it alone. For patients with joint replacements, like a total hip, the key is preventing dislocation. This means avoiding adduction past the midline and flexion beyond 90 degrees, which is why raised toilet seats are essential. The exam will test these precautions through Select All That Apply or Priority Action questions. Remember the 5 P's as your priority check, and you'll correctly answer the most critical musculoskeletal questions.